Okay. No. Hello.
Hello. So I need to catch up with all of us on the CBD AV stuff. I'm gonna go to George, and we're gonna make maybe 20 more. I don't know. I can't afford a whole 100, but we're gonna make a few more. I had one, my cousin, who has struggled with allergies his entire life. 3 times a year he gets bronchitis. He took 1 drop, and I told him, I said, you know, if you're a little sensitive, I just want you to put 1 drop on your finger and then smell it. He puts 1 drop on his finger and then he rubs it on his gums. And then 5 minutes later, he's like, I don't know, I can't tell what I'm thinking. Oh gosh, he's really sensitive. He's going to be having a hot flash or a headache or something like that. And he's like, I think I can breathe better. Hi, Candy.
Hi.
Candy, this is Dr. Blair. Dr. Blair, Candy.
Hi,
Hi,
Dr.
Candy.
Blair.
Nice to meet you.
Oh, thank you.
Is the sound okay? I can hear you well, Candy.
Yep, it's perfect.
Okay. Great. So I'm interested in speaking with you. I think there are some questions that you had, particular about ketones or ketogenic diet and how that might play a role. I was in, of course, you're following a protocol that is close to my heart. So I really like what you're doing already for it. And I'd like to answer any questions that you might have.
Well, as I was telling Ali earlier today, there's so much information that I've been getting so quickly in the last couple of months that sometimes you don't even know which questions to ask. I've learned a lot from Ali, which has been great. And I think the only thing I'm struggling with right now is the whole hormone blocker drug that they want to put me on for 5 years minimally.
Right.
And I don't know if there's some alternative to that, or just do that plus try to clean up, you know, all the toxins. And I mean, I'm just not sure.
Of course. Yeah. And it is all quite a bit of a challenge. And unfortunately, we don't have absolutely solid literature that really defines those things as we do with some of the chemotherapy. Are you going to be undergoing any chemo?
No, I don't. I have stage 1A. Nothing was in my lymph nodes. My tumor was 1.1 centimeters. There was also a satellite tumor of 0.3. I did have 2 surgeries because the first one, the margins were not totally clean. After the second one, they were. So no chemotherapy.
Okay. So what they want to put you on is a anti-aromatase therapy, and there's a couple different drugs. You gave me one drug. Tamoxifen is another form, and it's blocking the estrogen effect, especially for estrogen type of tumors. And
Right.
they determined this tumor was had an estrogen receptor in it?
Yes,
Mhm.
it does.
Yeah. So it turns out that CBD is actually an anti-aromatase substance. So it actually has some of the same properties as you would have with tamoxifen.
Uh-huh.
Now, how does that compare and the effectiveness? I can't answer that. I don't know how it does compare, except that in other cases I've been dealing with, whether it's estrogen sensitive or estrogen positive cancers, even triple estrogen positive breast cancers have been responsive to CBD, and they've generally had good results. 5 years is a long-term therapy, and there are problems with those aromatase agents that go into it, and
Right.
I think including osteoporosis and some
Right.
other difficulties that happen with it. As to whether your cannabinoid therapy is going to protect and still give you the protection that they found in chemotherapy trials, I can't say for certain.
Right. Okay. I'm just trying to make a real informed decision on all of this. And
Of
I,
course.
it's all the side effects that makes me just dig my heels in, because it's a long time. And, I'm 71 years old, and I think I don't want the whole, the rest of my life is not going to go on forever. And I want that to be
You want a quality of life.
exactly.
Mm-hmm.
Dr.
So
Blair, did you, I'm sorry, Candy, did you want to
that's
say
okay.
something?
No.
I wanted to touch upon the xenoestrogens. Do you have any comments on those?
Well, I think that certainly plays a role. Are you thinking in terms of an alternative strategy, Ali?
No, I'm thinking of, there's a doctor I follow. She's a breast cancer survivor. And she brings into the fact that these xenoestrogens that are in our lives, that are in our skincare products, in the pesticides, in the birth control, and then all the synthetic fragrances we have, are disrupting our hormones and are actually creating estradiol in the body, which is a very aggressive, bad form of estrogen. Because if really, if we thought about estrogen as our natural estrogen being a problem, then every 20-year-old would have breast cancer. So it's got to be something else, because I believe our human body is the most amazing machine around there, and we're just screwing it up with the toxins. So we got to figure out what the toxins are. And I really do believe that this type of a cancer can be deflected with getting rid of these xenoestrogens.
Ali, I think I do agree with you. I think that we're getting environmental exposure that is leading us to many of the problems metabolically as well as cancer-wise. Why else would this be going on when this was not seen a century ago? And what exactly is happening? So if I were you, Candy, I'd certainly adopt this approach, and it's benign. It just eliminates these possible estrogens, these xenoestrogens that can act like estrogen and may be defectively stimulating cancer cells in the process. And I don't think it's too difficult to overcome some of these things. And the protocol that Ali, that you have offered, that's pretty good, and it's a good healthy dietary program.
Right.
And combining that with the CBD and the caryophyllene that you're using, I think you'd be in good shape and well protected. And I don't think that you have to face using those particular cancer agents that they want to put you on.
Yeah, because it's like, even through radiation, they go through all the side effects, and the last thing they say is, and could cause cancer. And I'm like going, okay, wait a minute. This is kind of crazy.
Right.
Yeah, the therapies that cure cancer also cause cancer. And, how does that
Exactly.
work? And
Yeah, yeah. It's you know, if I were 30 years old, I might feel very differently about this, but at my age, I just, I don't know. I want the last, I don't know, 20, 30 years to be uh enjoyable, not
Right.
dealing with a bunch of side effects.
right,
Right.
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 So I guess the third topic there has to do with a ketogenic or intermittent fasting or a ketogenic diet. And the reason that is helpful is because that intermittent diet actually puts a situation into our bodies where of autophagy, where we are cleaning out the old cells of our body and eliminating them. So it's actually a biochemical stimulus that goes on,
Right,
and it's a cleanup operation. So
right.
intermittent fasting is a way to do that. Ketogenic
I've
diet
I've been
is also a
I've
way.
been intermittent fasting for 2 years.
Okay,
Yeah. I mean, I do it, but usually 6 days a week.
excellent. And then
Yeah.
that's a great approach. So if then kind of the next step is would be if you wanted to go towards ketogenic. And the idea behind ketogenic is it's going to deny glucose or limit the amount of glucose that a cancer is going to be consuming.
Right.
And when a cancer cell develops, they lose the ability to handle fatty acids. And their mitochondria become somewhat impaired. So uh, they don't handle the fatty acid metabolism well. And that means that if you keep the blood glucose on the lower level, then they struggle to survive, that's exactly what you want. You want
Right.
any of those surviving cells not to thrive and not to create clusters and develop into a tumor or metastasize and go anywhere.
Right.
The ketones and the intermittent diet and fasting actually generates ketones, and these happen to be almost therapeutic molecules in and of themselves in the way that they work, and they signal the body just as if you were taking something in. You can generate your own, and they have very positive effects on metabolism, on brain function, on organ function, as well as an anti-tumor effect that goes along with them.
Okay. Do you have a book with recipes, whatever, that you can recommend for the keto diet?
Yeah, I do. One of the best, and I was putting something together here for you, and I'll just send it out. It's an email that's going out that lists. Well, Diet Doctor is what I have found to be the most current and the best source for information, both about intermittent fasting as well as the ketogenic diet. And the reason that I like it very much is it's a nominal monthly charge for participating, but they've got hundreds of videos and expert discussions, as well as recipes and guidance and science. They've really done an extraordinary job about putting all the information together, and talking about it matter of factfully, without advertisement. So you tend to skip the advertisement. And if you really want to have the advertisement, you might
No,
want to go somewhere else.
no. Yeah. And I pretty much follow, I would say, a Mediterranean diet, or at this point I have. So, um, yeah, it sounds like it would be pretty simple to do.
No, I think it is. You've got to get past the fear factor for the most part, and people are afraid of fat, and so that's one of the issues to go on. Because if you eliminate carbohydrates, what do you replace it with? You've got to replace it either with protein or fat, and it is good to increase the amount of protein that you take in, but by and large, you're going to be replacing much of your foods with a higher fat content. Now, there is evidence to suggest that we really need to be eating more protein in our diet, and we're really not getting enough, and that people do better with a higher protein diet. However, there's all kinds of debates about what the right percentage is and how
Right,
much
right.
people should be eating. It does seem to depend on individuals and how they respond, and what is the optimum blend for you. What I found is that I practice a ketogenic diet. My wife is diabetic. She's a type 1 diabetic, kind of mature onset. And, and because she still has a very small amount of insulin production, then our strategy has been, and to preserve that insulin production that she does have, is to eliminate almost all her carbohydrates. And so in sympathy, then I follow that same program, and we don't eat much in the way of any carbohydrates except leafy green vegetables and low carbohydrate type of vegetables that go on. But I have to be careful, because if I get too extreme and try to eliminate too many carbohydrates, I actually have a problem with magnesium. So I have to consciously take in some carbohydrates in order to prevent that extra magnesium loss that I see.
Right.
And I'm just using that as an example that you may find that you have to customize for your particular needs, rather than, oh, just cut out all carbohydrates, that solves all the problems.
Right.
It's more complicated than that. Now, got a lot of experience with it. I can give you advice and recommendations on that, and if you run into problems. But also the Diet Doctor has some excellent material. In fact, I was listening to one of their podcasts, who's done by a cardiologist, and he does a presentation and has an interview at least on a weekly basis. So good information, and I think it's very scientifically based. And they discuss a lot of different problems that people have. I don't know that they talk about cancer.
Mm-hmm.
That's a dangerous topic. I've found that it seems to excite a lot of emotion. And when that happens, people get excited about it and you become a target. And nobody wants to become a target in any way.
Right.
So even my recommendations and my protocol, I'm pretty low key about. And I use it, I just put it in terms of anecdotal experience, say, gee, it works. I've got patients with stage 4 disease that it's resolved and they haven't had any more problem, when you would have thought they would have been dead by now.
Right. Right.
So with your cancer at the stage that it's in, your prognosis is excellent. And now the protocol that I've used at 90 milligrams is to treat acutely for a tumor and a stage 4 type of tumor, or for a period of time where you want to extinguish any residue of that cancer where it's metastasized. And almost all breast cancer metastasizes early, and they can't find it in single cells. It takes about 10 years for one cell to form to 1 centimeter in size. So it's a very, very slow process. But unfortunately, people do have recurrences of the cancer over a period of time. And so, like what they're doing with the tamoxifen or the other agent, the idea is to try to help the body extinguish any residual cells.
Right. Right. And that's exactly, I mean, that's what they say. And they just want to see results, and they know it works. And it's the only part that bothers me is it's the one size fits all protocol. They don't look at which stage you're in, whether it was in lymph nodes, they just give it to everybody across the board.
And it's not 100%. I mean, it's just because if you don't take
nothing
it,
is.
there's no guarantees on it. I don't know what the result is. I don't know what the percentage and the risk of a recurrence is, but what typically we find is that there is still a recurrence rate, a significant recurrence rate, even when your people have taken these agents.
Right.
But we haven't corrected the core problem. Why are we getting cancer? And
exactly. Instead of just treating it.
Right. And that's where Ali's idea here, and and approaching these xenoestrogens as a possible abnormal stimulus that
Right.
could lead to problems.
Yeah.
More currently, I'm focused on some of the omega-6 types of oils that we encounter, the seed oils. And with the same idea, Ali, that the idea here is that these are going to create oxidized products that are inflammatory to the body, both within the metabolic issues, but also in signaling and inducing reactive oxygen species and immune reactions that lead to the formation of cancer. So that's my particular hot area, but I think it's a very close parallel with what you're talking about.
Yeah, I would agree. I would agree. And I think that they're starting to put vegetable oil in everything. Like whole grain wheat bread has vegetable oil in it, and your great, nuts that are lovely, but they have to, roast them in canola oil. It's like, yeah,
Yeah.
it's coming in every form. And now we have to be really diligent about reading labels
Mhm.
and reading ingredients, not necessarily just the label.
Right.
Right, right. So we have to have omega-6s, but if we have too much of them, then they create an inflammatory situation. And omega-6s, when they are bottled and maintained or heated at high temperatures, then they become oxidized and abnormal substances that lead to inflammation within the body and perverse metabolism that goes on with it. So
Right.
a lot of the same concept here is that we bring in these processed foods. It leads to disruption in how our body deals with these particular stresses. And so I'm of that philosophy that these are the root causes, and that we've got to control those factors in order to prevent some of the epidemic that we're currently seeing, both in metabolically and with neoplasms, cancers.
Yeah.
Dr. Blair, does the oats, not the oats test, but any of your toxicity tests, do they look at something like estradiol or these xenoestrogens, or even the oxidation level? I mean, the problem that you're discussing with the vegetable oils or the omega-6s oxidizing.
Well, they do an omega-6, omega-3 ratio as a separate test and looking at those. But the other studies are looking at toxins, both mycotoxins and environmental toxins, as well as glyphosate. So we're looking at some of those other chemicals that are disruptive of the metabolism. And I don't know if that they're addressing that particular issue other than what we've just kind of mentioned, gone over.
Okay, I had a question there.
So it's not some, I don't have a wholesale recommendation for doing that particular testing.
Yeah.
I don't know in Candy's situation whether it would be particularly valuable unless, Candy, have you had a mold exposure?
Not that I'm aware of. I mean, I don't think so, but
Dr. Blair, do you think some people are more susceptible to glyphosates? And maybe that might be this doctor that I follow, Dr. V, I think I sent you some information on
Yes.
her, Dr. Blair. She has a test where she tests for the bromides, chlorides, the fluorides, especially with breast cancer. What do you think about that?
I think there's some really good arguments that say that can be quite valuable. I noticed I actually had that test done, and I found that I actually had high fluoride contents. And as it happens, I had the start of a dental cavity, and I had done some literature research and decided I was going to use some intensive fluoride treatment in order to resolve that. So after a year, I actually did resolve the cavity. It went away. it closed in. So that was successful. But when I happened to do the bromides and the fluorides, I came up with a very high level of fluoride, and that was an indicator I needed to stop that because it was probably interfering with some other processes. But in addition, I also had high levels of bromide. And I couldn't figure out for the life of me how I was getting that kind of exposure. And the way that you get rid of that is high doses of iodine. So that displaces it and the halides. But I found that I was intolerant of any significant amount of iodide. So I'm gradually have been developing some tolerance, and I can take more of the iodine. But I think that could very well have a role. I don't doubt it. I'm not familiar with it in terms of links to cancer, though.
I've done a little bit of researching in that arena just because I work with a woman who used to be a oral surgery PA, and so she developed her own dental toothpaste. And I started looking about the fluoride, and Dr. Mercola has quite a bit about fluoride and how, of course, in our teeth, that's, that area is the most vascular area we have. And Dr. V also talks a lot about oral care and how that can impact cancer, and especially breast cancer. So yeah, Candy, I have a good dental toothpaste if you want to switch, because
you sent me that, and I did order that.
Okay, good. I mean, because when I started using that dental toothpaste, my pockets started closing up. And I have also used a CBD, or actually a low THCA and a CBDA product when I have gum issues. Any of my friends have had their tooth extracted or tooth infections. I put the CBD right in the socket, and it usually clears it up in a day or two.
Wow.
Yeah, it's definitely a great potential for the dentist, but as we've talked about that, Ali, it's difficult to get the dentist to come over to that way of thinking.
It is.
Well, it's difficult to get any Western doctor to be open to all of this.
Yeah.
Well, any doctor around the world, whether it's Chinese or Japanese or Korean, it's a problem everywhere.
Well, yeah, I guess so. Yeah.
Yeah.
But yeah, I mean, hopefully that will start changing in medical school. And
can I go back to the intermittent fasting? Dr. Blair, what do you suggest? I mean, Candy already intermittent fasts, but what do you suggest in terms of 16 and 8, 20 and 4, every week, do 24 hours, 48 hours? What kind of intermittent fasting are you talking about?
Well, I think that people ought to incorporate it into their lifestyle. And what they find out with intermittent fasting is, as Candy has done, is that you just change your approach. You don't wake up and have a donut and have a bowl of ice cream at night, and so that you're essentially typically having 16 hours of fasting on a daily basis. And so you can eat at 10 a.m. Assuming that you get all the time that's required in there, and you incorporate it as part of that lifestyle and approach. So I like the 16 hours. That's something I practice, and it's a very easy way to what you'd have to overcome is family and friends.
Yeah, it's not an issue for me. I'm usually 17 hours. And then there's days where I literally go 18 to 20 hours. And I don't even think about food till noon, 1 o'clock. So it doesn't, with my family, it works fine. And Ali was mentioning that once a week I should go longer.
Yeah, I've followed a lot of a few guys that do the intermittent fasting, and if you can do like maybe even a 24-hour fast. Now, obviously, if it makes you lightheaded or, whatever, you're getting negative effects from it, obviously don't do it. But if you can do a 24-hour fast, that autophagy will really start to clear out.
Well, I've heard
What do
those
you think about
recommendations. I've heard anywhere from 1 day to 3 days to 5 days to a week. Everybody's got their own magic potion
Right.
and their protocol. And that's, I think, is going to go back to you, Candy. What do you feel best with? And maybe worth experimenting in some areas. But I don't think that extended fasts are a good idea. That's my bias. I don't think that we need that kind of thing, especially if you're doing things like intermittent fasting.
Right.
And what do you mean by extended fast?
Well, like a 7-day fast or longer.
Oh, okay. Yeah, but
Oh,
what about a
like
24-hour fast?
like once a week, Ali, you thinking, or
Well, I was thinking once a week or once a month, do a 24-hour fast. What do you think about that, Dr. Blair?
Yeah, I think that's entirely reasonable. And
Okay.
what you
That would be
have to
easy.
decide is, hey, does it make a difference for you? Are you noticing particular benefits from doing that?
Right.
A log of how you perform and how you function, and see what kind of positive or negative changes happen with it.
Right.
Yeah. Because what they say is that, if you stretch it out to 24, then your body's really going, okay, we're going into starvation mode, and the body becomes much more efficient. And then also the autophagy increases. So I kind of liked that theory. I don't know.
Well, you're
Especially
pumping out
with cancer.
ketones, and you're affecting the autophagy a particular sequence, and so you're cleaning out the dead cells that are
Yeah.
present. So
Yeah. Well, that
it's
would be
not bad at
totally
all.
easy. Yeah.
And the other, talking about cleaning out dead cells. So Candy has some redness, little bumps on her right breast, right? You said, and
Mhm.
my suggestion was to take I have a CBD bentonite clay. It's called mud, but I don't have it with me. So she's going to just put a little CBD in her face mask and put it right there on the skin, because my point is there's something in there trying to come out. And I've had clients in the past who have breast cancer, and the cancer actually expulsed out of the skin. And my point is, well, let's get it out there. The doctors are like, oh, don't worry about it, it'll go away. Well, sure, it'll go away. It'll go back into the body. Let's try and get it out.
Well, I think
It's
that
back there.
if that works, that would be a great strategy.
Yeah.
I'm not familiar with the evidence on that, but it's certainly not going to cause you any harm.
Right. It sounds like it makes sense. I
Yeah.
mean, and it like you say, Dr. Blair, it's not going to cause harm, and
Yeah.
seems like it might clear it up a little faster.
Yeah. Yeah. We use like I use the mud with bentonite clay and CBD for the herpes on the lips. And as soon as it's kind of like a migraine, people know when it's coming, they feel a little tingling. And as soon as they get that tingling, they put the mud on there, and it pulls whatever it is out, and it just goes away. It's really, it's very nice.
Well, that's great. I've had good success with using CBD in a lip balm for that as well.
Yeah.
It doesn't have to be a high concentration
Yeah.
in order to provide protection against the viral, either fever blister or HSV. So that's a good strategy. I like your approach. And the mud may offer some real extra benefits.
Yeah. Yeah. So Candy, I'll be getting that hopefully at the end of the week.
Okay. All right. I'll be out of town till I think Tuesday of next week, but yeah,
Okay.
we'll be in touch about that. But in the meantime, I'll mix that CBD with the clay mask, and
Yeah, try it out.
Oh, I see. Yeah, that's what you were talking about, the clay mask and
Yeah.
using it that way.
Yeah.
Yeah.
So clay masks are typically bentonite clay, zeolite type of clay.
I don't know what Candy's is, but my CBD mask is bentonite clay.
I don't know. I'd have to read it and see what it says. I'm not sure.
Yeah.
I mean, it's a face mask,
Mhm.
so, but I'm sure it's the same thing where it's drawing things out.
Well, the clay acts as a detoxifier, absorbing those chemicals that cause a great deal of difficulty for us, and combining them. We actually parrots gorge themselves on it, and other animals will gorge themselves on bentonite type of clay in order to reverse the toxicity of some of the foods that they eat.
Oh, interesting.
Well, that brings us to activated charcoal. Have you ever used that, Dr. Blair?
I'm familiar with it, and as part of the detoxification, I think that's a really good program. The only thing you have to watch out for is that it deactivates lots of things, and so you've got to stay away from other supplements that you might be using at the
Oh,
time.
like what? I just want to make sure, because I'm taking that now. So
the idea with the activated charcoal is that it's going to do some absorption. And so if you're taking any medications or particular substance and staying away from a period of time, I don't know exactly what that period of time is, but it might be a couple hours, so that you're not going to lose that particular benefit of that particular substance
okay.
by absorbing it. So I know Dave Asbury was using charcoal, and he had emergency charcoal supply. And so that if he'd go to a restaurant or ate the wrong food and realized that he was exposed, then he would pop a handful of the charcoal, and it would neutralize the chemical toxins that he was exposed to. So you can look at it as a technique to deactivate. When patients are poisoned, that's after you empty the stomach and you irrigate the stomach and try to get everything out, then you load the patient up with charcoal and to try to absorb those chemical substances, particularly Tylenol, acetaminophen. That was one of the common overdose. It still is a common overdose. And in my experience, everything turns black dust all over the place with patients, and white coats too.
Yeah.
When you're doing any type of volume of charcoal and trying to put it down feeding tubes and such.
Oh, wow.
Yeah, so what he's saying is, don't take your activated charcoal with all your vitamins, because you're just going to, attach. I mean, so if I know, tonight I'm going to go meet my rugby buddies and we're going to go have a beer. And so 30 minutes into having a beer, I'm going to take 2 of my charcoal capsules, because I know it's going to help my liver. It's going to, help maybe some of the alcohol not being processed by the liver as well.
And it's gonna take out those B vitamins in that beer. My goodness.
I know. Well, I'll go home and get some more B vitamins. Yes, I know. Well, doesn't alcohol block B vitamins uptake?
Could be. I don't know that.
I think that's why when we were in college, the day after, we would definitely take a bunch of B vitamins.
Yeah, I've heard that too.
Yeah. And then I looked it up, and I think alcohol blocks, alcoholics have low vitamin B because it blocks the vitamin B. But anyway, I don't know. It's kind of interesting. Yeah. So I have an omega-3, turmeric, something else, CBD coffee. I have a hangover thing that, because I am way too old to get a hangover at this point. But literally, if I had 3 beers over a 3-hour period, I'd get a hangover.
Well, I'm a teetotaler myself. I can only tolerate about 3 ounces of wine, and that's it. Can't. Otherwise, I'm drunk. Cheap date.
Yeah. Well, and you're also very sensitive to CBD. I mean, it really affects you quite nicely, but just a small amount.
Yeah, I do pretty well with it. 15 milligrams gives me a pretty level and even effect.
Yeah. All right. So Candy, you're on the Bracco Protect, right? The sulfur.
Right.
right?
Mhm.
Okay,
Yep.
and you've got omega-3s,
Yep.
and the BCP now, right? The topical. Do you have the BCP, beta caroophyllene, the topical? It's like,
No.
So look at I just have the 40-minute webinar
Oh.
type of Zoom. So that's
Okay.
going to expire very shortly. I just want to say, Candy, it's a pleasure talking with you. I'm glad to provide
Thank
this
you.
information.
I
And,
appreciate it.
you're very, very welcome. And I'd like to find out how you do with it too. So keep me
Okay.
informed.
Okay, certainly.
okay.
But we'll stay on. Go ahead. I don't want to interrupt. I just want, as
Well,
it
she
says,
definitely
it's
needs the
less than a
BCP.
minute.
She definitely needs the BCP. So I'm sorry if I didn't give that to you, Candy. I
The
couldn't-
BCP, and you say it's a topical.
Beta caroophyllene in a little 1 ounce eyedropper bottle. Has a
Mm,
real tough, cool, like.
That's not what you gave me today, is it? Because
No.
I'm sorry, didn't even, no, okay,
No.
then no.
No, okay. I need to get you that.
Well, it's
Okay.
it's a clear oil, and BCP is caryophyllene, and it works as it's a cannabinoid on our immune receptors, and so immune type 2 receptors, and it's been very effective in combination with CBD as an anti-cancer effect. It also is an
Oh.
immune modulator. So my greatest success has been with those particular combinations, and that's why I'm really enthusiastic about it. Now, if you
Oh.
get past the acute therapy where you say, well, I'm doing 1 month or 2 months or 3 months, and then you're going to relax on your therapy and just go into a maintenance dose, you're completely safe for that. And how long do you continue with the acute therapy? The 90 milligrams you're doing, that's up for debate. I would say at least a month. You may want to go for 3 months and then reduce it down to that maintenance level. And for you, a maintenance level is going to be on the order